Hey everyone, my name is Alvin Sun, your podcast coordinator for the Surgery Interest Group. Welcome to the episode in our podcast series where we invite guests to share their expertise and experiences in the field of surgery. So today I'm excited to introduce our guest, Dr. Nathaniel Uecker, board-certified general surgeon, specializing in minimally invasive surgery and endoscopy. He's taking the time to join us today to share his journey, answer the questions you guys had. He's actually a Ross alum and completed his general surgery residency at Maricopa Integrated Health Systems in Arizona. He then spent 10 years practicing at Mayo Clinic Health System in La Crosse, Wisconsin. He's now with Samaritan Health in Newport, Oregon. So I've actually had the privilege of working alongside Dr. Uecker as a scrub tech back when he was at Mayo, which now seems to be a super long time ago. Always great to work with, down to earth, super efficient. Learned a lot from him and definitely played a role in my decision to pursue surgery. So without further ado, let's welcome Dr. Uecker to the podcast.
Fantastic. Thank you so much, Alvin.
Yeah. Right.
You kind of summed it up. I went to Ross and then did residency, most of the residency in Phoenix at Maricopa County. I was actually a preliminary resident in Arkansas and Little Rock at the UAMS program. I was there for 18 months, and then I got a categorical position in Phoenix. And the reason that was that I got the preliminary job because that was the only job that I was offered. It was hard to match, but I was speaking with Alvin before this, and I basically missed the match because of the 9/11 Twin Towers attack shut everything down on the East Coast. And that language exam that we all had to take in Philadelphia was canceled during the time that I was set to take it. So I couldn't take it. So I missed the match. So I scrambled, and I remember sending faxes to all sorts of places. And I had interviewed at Arkansas, and they said, yes, you can be a prelim resident there. So that's where it all started. It was kind of a weird day, but it all worked out. And then from Arkansas, I was offered a categorical job at Maricopa, which is now part of Creighton. And from there, went to Minnesota to a community hospital for 3 years, and then Mayo Clinic, not the big Mayo, but La Crosse Mayo, which is about 50 miles from Rochester. I was there for 10 years, almost exactly, and then we moved out to the Oregon coast, just like Alvin said. So that's my backstory. I am a general surgeon at a community hospital. We're a critical access hospital. It's a level 4 trauma. So basically, we don't do a lot of trauma. Sometimes they show up. I've done a couple of cases. I did a splenectomy in a great big guy a couple of years ago, but it's pretty rare. It's basically bread and butter general surgery, with most of it being laparoscopic, but we just got a robot about 6 weeks ago. So I've been using the robot. I just did my 5th laparoscopic cholecystectomy a couple days ago. We're starting to do hernias and things. It's all kind of fun and cool. But definitely general surgery out on the coast, kind of on the edge of the edge.
Nice.
So what questions? What can I talk about?
Yeah, so how did you actually end up choosing general surgery in the first place? Like, how did you decide on that story? Kind of heard about it.
So my dad was a pathologist, and he used to go out this little town called Hutchinson, Minnesota, which is like 40 miles from the cities, and he'd do the pathology work out there. And I used to go out there with him every once in a while, and there was an old general surgeon there named Dr. Remicall, who's still alive. And he just seemed like a very positive influence in my life. He really enjoyed his job, and it struck me as something that I'd like to do. And I was just in high school at the time, and then I went to college, and plans changed, and then it kind of came back to general surgery again. I've really only ever seen myself as kind of a smaller town general surgeon, which is kind of a weird thing to say, I think, these days. I started out that way, and then we veered off into La Crosse for a while, and now I'm kind of back to my roots. But it had to do with early exposure with somebody that I admired, who really enjoyed his job and just was really supportive.
So you kind of migrated towards the minimally invasive approach then as you started practicing. Is that kind of how the
Well,
minimally?
in my residency, most things were done laparoscopically, even in late 90s and early 2000 era. Let's see, I finished in 2006, I think, 2007. So yeah, all right, early 2000s. It was all pretty much laparoscopic except for all the trauma that we did, which was all big laparotomies.
Mhm.
So yeah, I'm a little past the guys that did most things open and then sort of trained into laparoscopic.
Gotcha.
I'm doing that now with robotics, actually, which is
Yeah.
kind of interesting. Yeah.
So that's kind of I think within the next 5 to 10 years, robotics is kind of the I guess the next thing for minimally invasive surgery. I think for the most, I've seen it
Yeah.
used quite a bit. Even like urology and cardiothoracic, I've seen some valve replacements. That's kind of been
Yeah.
developing.
It's going to be the way that you and I get operated
Mhm.
on when we're old.
Mhm.
Yeah. It's right now I'm just doing hernias, inguinal hernias, ventral hernias, and gallbladders. We haven't introduced it into like, you know, cases on call yet, like appendixes and things like that, but that's coming. And
Yeah.
it's easy and it's fun and it's cool and the visualization is really nice. But you also have to know how to do it laparoscopically and how to do it open. And yeah, you have to know all the ways.
Yeah. So you like it overall so far, or
Yeah, I
yeah?
do. It's awkward. It's like driving a it's like driving a rental car. You know where everything is and you know the rules of the road, but it all kind of feels weird.
Yeah.
You know,
Yeah.
that's the best way I can describe it.
What does the training involve? Is that do you have to get proctored for a certain amount of
Yeah,
cases? I know you attended conferences or training sessions in other
yeah.
states.
They sent me to Vegas for
Yeah.
something and then to California for something, and you watch a bunch of cases, and then you go and you watch a surgeon do cases. And I swear to God, he had the easiest cases I've ever seen. He had a hernia. There was like hernia after hernia, and there was no hernia there. And he just kept fixing them. And I'm like, okay, you fixed a hernia, but
That wasn't
um, yeah, it wasn't there. So yeah, you do some proctor cases, and then we're supposed to do like half a dozen cases where there's a surgeon. It was weird. They come to the hospital and they're with you while you're operating. And if that doesn't work, you wear these sort of headphones and they're watching you operate on a screen,
Hmm.
kind of helping you that way. So we did that a few times, and now I'm kind of on my own. I think it varies depending on how easily you kind of take to it. And
Mhm.
yeah, it took a couple. I've done a dozen cases exactly because I just looked yesterday. I've done a dozen robotic cases,
Okay.
and yeah, it's pretty. It's all right.
Yeah. Is it kind
And
of
when you do, sorry, when you do residency, that all the residencies really are just. There's so much robotics in residency.
yeah.
You guys don't need to worry about retro training into it because that's going to be part of the daily routine.
Mhm. Yeah, I kind of see that now even. A lot like
Yeah,
most of the general surgery cases, a lot of them are now robotic assisted at least. So
yeah, yeah.
yeah. Yeah. Um, yeah, I also just see that you have an interest in skin cancer and flap closure procedures too. How did that come about? Is that still
You've
a
been
thing?
reading my bio.
Yeah.
Yeah, it's fun. There's a need for it here because there's a lot of older people on the coast
Mhm.
and a lot of long sun exposure history and people from California and people from Hawaii. And they don't want to go into a bigger city to see a dermatologist or see a surgeon. And so we just end up dealing with it here. Just 2 days ago, I took this big sort of half-dollar size thing off a guy's cheek that was eroding into his face. It turned out to be a squamous cell. We did this cool it's called a pedicle, like a pedicle advancement flap, where you cut sort of a banana shaped piece here and then slide it up.
Oh.
It was slick. They wouldn't have let me do that in lacrosse. Why? It would have been.
Yeah.
Get a plastic surgeon. But this guy is 80 years old. He doesn't care. He just wants it off his face, and I don't want it to keep burrowing into his cheek, or I'll be looking at his teeth.
Yeah.
So
Wow.
yeah, we removed that. That was the second case. The first case was a robotic cholecystectomy that took 22 minutes, which is pretty good.
Wow. Yeah.
And then the third case was a port, and then the last case was a lymph node biopsy, and that's kind of general surgery, basics out here.
Yeah. That's kind of your typical day then in the
Yeah.
most part.
Well,
Good.
no, my typical day is endoscopy actually, but that
Endoscopy? Oh, yeah.
my typical operative day would be like that. Yes,
Okay. A lot
but
of
there's definitely a lot of endoscopy out here.
gotcha. A lot of EGDs and colonoscopies, that kind of
Yes,
thing. Okay.
but
Okay.
that's just what the community needs. So that's what you do. It's good for
Yeah. What do you like doing the most?
them. um, I like the surgeries where it's challenging and there's some sort of problem to overcome, and you overcome it in kind of an elegant, cool way. And nobody in the room may even see what's happened, but I know that I did it and it was slick.
Mm,
And that's it. You like the ones that are kind of quick and difficult, but not, not overwhelming.
yeah.
It can be anything. It could be a little appendix, or it can be a colon case. It can be a skin cancer. Yeah,
Mhm. Yes.
it's all over.
I guess another question is, how was the transition from residency to your first job as an attending? Was that a
Oh,
confusing transition?
yeah, it was much easier because of where I was. The surgeon that I worked with, it was a very safe environment. He knew my family for 30 years. He felt like more of a mentor than sort of a competitor, or somebody that was out to find problems with my outcomes, or
Mm,
it was a very nurturing environment. When we interview people out here, if they're new, like still in residency or close to the end of the residency, you want to say, like, look, you need to go to a place that has some older surgeons that will kind of mentor you, because you're going to be in over your head a lot at
yeah.
first, and you need somebody who's seen a lot of crazy things and can
Mhm.
help you and do it in not a you know judgmental way.
Yeah.
I don't know if that sinks in much, but that is definitely the way that it worked for me, and it worked really well. And I don't regret that decision, even though it was kind of, we moved from that town to La Crosse, and it was expensive and a lot of upheaval, but still worth it in the end.
Yeah.
Yeah,
That's always kind of a thing that I always wondered, like that transition period, how like support and learning, mentors, things like that. So
yeah.
definitely.
You want to be around a few old guys, gals,
Mm,
that have seen things.
yeah.
Yep.
How's your current job now compared to before?
My what shop? Sorry.
Your current one, not in Oregon.
How's the job?
Yeah, compared to like other two. You're
Well, it's you know, Mayo was getting tight. I don't know what the right word is. I didn't like the direction that it was going. We would ask Rochester for a vascular surgeon, and they'd say, okay, here's your colorectal surgeon. And we'd say, well, we all do colorectal surgery. Why do we need a colorectal surgeon? And they just, yeah, this is what you get.
gotcha.
And then, of course, I had a partner who hurt himself and had to retire, and then two other ones were retiring and imminently, and it felt like there was a lot of turnover of people, and I didn't like the direction it was going, so I decided to get out. And it was a good time for my family because my daughter would just graduate from high school, and it was a time where we could all kind of move. But still, hugely tumultuous and expensive and very hard. It's not easy to move a household across the
Yeah.
country. The job is different in that it's much smaller group. I feel like I'm sort of part of a solution rather than kind of an annoying surgeon who complains about things when I should just, keep quiet and do my job. Um, it's a different feel. It's less of a corporate feel and more of a community feel. But
Gotcha.
there's also bad things. It's a smaller place. It's harder to get patients shipped off to bigger facilities. Back in La Crosse, if we wanted to send somebody to Rochester, they would be gone in like a half hour.
Yeah.
It was instantaneous. Here, it can be really tough to get somebody out of here into a higher level of care. Um,
Yeah.
so it can be frustrating.
Yeah, that's kind of my next question. Like, what are some of the biggest challenges you're facing practice? Because
Yeah,
right?
it's lack of resources. Um, the nursing isn't great. I don't. I mean, the nurses, you guys in La Crosse did a fantastic job. I have basically two people that are on the same level as the random nurse in La Crosse was.
Mm.
Everyone else is they're just doing their job. Like they don't care. They're nice, but they don't care. And it's hard to get people to replace them because we're out here on the edge of the freaking continent, and
Yeah.
it's expensive to live here, and it's hard to move here, and yeah, so it's a different deal.
Gotcha.
But the robot, you use the robot, you can assist yourself. So you move the camera in, and you don't have
That's
to
true.
rely on anybody. It's just you and a console.
That's true.
Yeah.
Yeah. What do you find most rewarding, I guess, in the other side of the challenges?
Oh, it's just it's helping. As hokey as it sounds, it's helping people. It's saving every couple of weeks. I get to save somebody's life, and that's kind of pleasant.
Mhm.
They're thankful. I'm happy. It's life affirming and career affirming, and it feels good. It
Yeah.
reminds you why you do what you do,
Mhm.
and it's real and it happens. The orthopedic surgeons don't get to save people's lives. They get a ton of money and a lot of divorces, but they don't get to save anyone's life.
Good point. I guess the other topic that people were wondering about was with, I think I mentioned it earlier before this, with residency and the ERAS application opening up. Many of us will
Yeah.
be applying this cycle. I guess what aspects of your application do you believe contributed most, or at least significantly, to securing a position, at least a prelim position you had at first?
So all right, I had some thoughts just now. The first one was when I was in La Crosse, there was a resident at Mayo who was from Ross,
Oh,
and I thought that was fantastic. There was only one that I remember in a couple. I think I taught residents for 5 or 6 years, but
oh,
there was somebody there that went straight from Ross University to the world famous Mayo Clinic in Rochester and started a surgical residency. I don't know
oh,
what that guy's name is.
oh.
He
I
did
actually tried
fine.
looking that up. I never found anyone.
There was
Oh,
one.
okay.
So you can do it. It's totally possible. It's really hard, I imagine, but it's possible. Regarding the application part, when I was a senior resident in Maricopa County, they would involve us in looking at the applicants.
Hmm.
Um, it was kind of nice because you got to see how the attendings are thinking and what they look
Yeah.
for. And really, once you get to a certain bar of I imagine grades. I don't know. Once you show an interest and you decide you want to do surgery and you can prove that you can walk straight and tie your shoes and stuff, um, they were most interested, it seemed, in people they could just get along with for 4 or 5 years,
Yeah.
which is a totally weird. Like you never think that as an applicant. Like why would they care if I'm nice? But the fact is, you live with these people for 4 or 5 years. You have a long relationship with your
Mhm.
attendings, and if they don't like you, they're going to make it very painful, and they're not going to accept you if they didn't like you during the interview. So I guess just try to be really friendly and positive and likable would be the first
Yeah.
kind of weird thing to say that is totally true. You know,
Mhm.
you got to be somebody that can get along with other people for a long time, and in a very high pressure job.
Makes sense. So the interview is pretty important then in that respect.
Yeah.
So, okay.
And I don't know how you could teach that. Like, be likable. That's a weird thing to say, but
Yeah.
it really, like, if there were a couple of candidates and they said, "Oh, it's candidate B or C," what do we? Well, I really liked C more. I just simply liked her or
Yeah.
whatever, and that would be enough to get her in rather than somebody else.
Mhm. So scores kind of only take you so far, and then once
I
you get
think
the interview,
it puts you
yeah,
over like a ledge, and at that point, there's a
gotcha.
lot of personality.
Okay.
Yeah.
Do you remember what they frequently asked about? Like, did you have a couple interviews? Do you remember what like they frequently asked about, or is it just kind of random questions?
It was random.
Random- yeah.
It was. I remember there was one in where was it? Knoxville. I think it was just a dinner. Like it was just they just wanted to see how you hung out. I don't know. It was.
Is it like with other residents that during that?
Yeah,
Yeah. Oh,
yeah.
okay. Yeah. Yeah.
Um, I don't remember any particular questions. I remember just sort of explaining what I wanted to do and how I felt about taking care of people and wanting to solve problems, and
Mhm.
I felt like people deserved care, and and respect, and just stuff that's true and easy to say because it's true.
Did you run into any issues like during this process, like coming from Ross? Like I know the stigma has been a little better for Caribbean students now. It has improved, but I know that still kind of exists during that process, application process.
Not for a long,
Mhm.
long
Okay.
time. And never really to my face.
Okay.
But just the other day, I had a patient say, I researched you and I saw that you went to medical school in the Caribbean, and I said, yeah,
Mhm.
you did. And it was fantastic. I loved it there. I wish I was there right now. It was beautiful.
It is.
You just, I think if they think about it, they're going to realize that you had to kind of fight for things a little bit more and be a little bit more scrappy and kind of prove yourself more to get to where you are
Yeah.
than somebody who just kind of fell into it. But nobody ever, I don't think anybody's ever said to me like, well, yeah, I don't want you taking care of me because of where you went to medical school. I mean, really, it's mostly about like, do they know somebody that you took care of, and did that person like you? And if yes, whatever. And then the next thing is how you treat them. And the third thing would be like where you trained or where you were at last. I mean, really, medical school is way down the list and
Yeah.
things that people seem to care about.
Gotcha.
And if you find somebody that really cares about that, they're probably not going to be happy with you anyway. You could do your best and do everything right, and they're just going to say, well, I never liked that person, and I wish I had gone with a US grad the whole time, because they're going to find a problem.
Yeah, that makes sense.
So nuts to them.
Yeah, that makes sense. All right. So you actually did a whole prelim year before you got a category position.
I did.
Okay. Did
So I
that
did a whole,
Yeah.
what?
Yeah, go ahead. I was just gonna ask if that program supported you in order to get the categorical, how like
Yeah,
that
so
process.
I did that whole year at the University of Arkansas,
Hmm.
and I had a very supportive program director and chairman. I'm blanking on his name. John Edwards, I think, was his name. He was a Southern guy. And then the program director was a guy named Jensen. So they were very supportive. They're like, okay, Uecker, you're doing a good job. Just keep doing a good job. And there comes a point at the end of your first year where you either start the second year as a prelim,
Yeah.
or you keep and the whole time I'm looking for a categorical job as an intern, and I'm not finding anything. And they said, yeah, we just keep going. We'll find you a spot. It was what they kept telling me. And you got to believe them, because what else are you going to do?
Yeah.
And I got halfway through my second year, and I was told I had a categorical position in Phoenix.
Mhm.
And then I needed to be there in about a month. And that I had, that was it. I wasn't really given much of a choice. It was like, you have a categorical job. Congratulations. And I remember saying like, hey, I just bought a house. And they said, oh yeah, that was stupid.
Oh man.
And then we sold the house, and we moved to Phoenix.
Okay.
And it really boiled down to a conversation that my program director had with an old buddy of his in Phoenix. Like hey, we need a categorical guy. Do you have anybody? Yeah, we got this one. Off you go. I was traded, basically.
So networking
Yeah.
helps.
So you just keep working and doing your best and showing up every day, and things will work out.
Was it a category? Was that a PGY1 position then? It wasn't from
Yes,
a PG, okay, you did intern
it
year.
was a kick in the pants. Yeah. So now I'm a PGY1 halfway through my intern year. So I
Oh,
was an extremely good intern, is what it
yeah.
did. I did 18 months of intern year and 18 months of second year.
Oh, wow. Okay.
Yeah. It is what you just, you go where the job is,
Yeah. So the prelim year, was that the same experience as an intern year? Is that like the same exact experience?
Well, it's not quite.
No.
The preliminary residents at Arkansas we weren't on the same track as the categorical residents.
Oh,
They tended to sort of shunt us off at the VA to put lines in for a month. And
oh,
it was just sort of we were kind of extras. We were backups, in case the
oh, gotcha.
categorical had a problem or something, and then we'd fill in.
Hmm.
So not exactly the same route. There were two of us. The other guy was a Mexican dude named Nurko, who I think he did fine. I don't know where he went, but we were both just kind of on hold, waiting for something to happen.
Okay.
And for me, it was Phoenix.
Yeah. Gotcha.
Yeah.
Yeah, we were always told, advised to ask about the preliminary positions with the current residents to make sure that they're like supportive and they actually do more, like you're on a similar level as categoricals. Otherwise, might be an ideal experience. So it's kind of hard to
Yeah.
tell which programs support or if they don't support, or they
I
may
don't,
do more floor work.
you feel like you got to do, you have to do well every day, day after day after day. You're kind of, you're on your best behavior the whole time.
Yeah.
Yeah.
Yeah. Yeah, so I guess the question is for prelim, is it better to reapply the categorical
Oh,
or to apply preliminary programs as well and get in that way? It's kind of hard to decide on that.
oh,
So
yeah. I mean, I took the only job I could get because of what happened with the match.
yeah,
So you know, I don't know if I can answer that with
yeah,
a with advice. It depends. Maybe if you had a feeling for how often categorical jobs were sort of falling off at a place, so you knew there'd be like, okay, they have a 30% attrition rate in their categorical group, so there's a good chance that I'll move into one of those spots. But if there's like 6 categorical residents, maybe you won't,
yeah, yeah. So you actually didn't apply to any prelim, right? You applied to categorical, and then there was a prelim that
I
oh
couldn't apply at all.
oh you can apply. Okay,
I
gotcha.
didn't, no, I didn't have
Okay,
a completed
yeah,
application because I couldn't
gotcha.
take my whatever that
That language.
ECFMG, yeah,
Yeah,
that language test.
yeah,
So
yeah,
I was like, I didn't exist.
yeah.
So I basically on scramble day started calling around, and Arkansas said, "Hey, you interviewed here." Yes, I did. Okay, and then I got a acceptance. That was it.
Gotcha. Okay.
It was it
That's
was chaos.
I was gonna say it's even more stressful than what we're going through now.
It was, and everything was done like by fax. Oh, it
Oh
was
man.
horrible. Yeah.
Yeah. Oh. Okay. Yeah, so that's pretty much it for the question. Just any other advice for medical students interested in surgery so they kind of navigate their way through this?
Just
And since you actually, yeah,
you can all do it. You can.
yeah,
This is so doable. I mean, it's a lot of hard work. It's a lot of showing up every day. It's a lot of. There's days that are really hard, and but you just keep doing it, and it'll happen.
yeah.
It probably takes a little bit more grit coming from a foreign school, but I think at the end of the day, you're going to be better off because of it.
Yeah.
Nothing will be handed to you, but if you work hard, it'll happen.
Mhm. Is there anything you wish you knew before becoming a resident and attending? Any insights you wish you had?
No,
No.
no, I
No. It's all,
I always had this
it's all
I
good.
always had this just sort of weird conviction that it would all be okay.
Yeah.
Which was probably super naive, but it's true. I really feel it's true. I feel like I've known residents that I didn't think could do anything somehow get through it. And the fact is they kept working, and they
Mhm.
just kept at it. I knew a resident who cried every day in her car before the day started. She'd just sit in her car and weep.
Oh
And then
man.
I know, and then she got out of her car and she went to work. Now she's a plastic surgeon. I mean, it's not, you can do this.
Wow.
Several years of being very uncomfortable, but then you get through it.
Yeah. Are
Yeah.
things better after like
Oh yeah.
things better on the other side?
Yes.
Yeah. Okay.
Yes. It's more responsibility, but more autonomy. It's a different, yeah. And then you're all of a sudden you're getting paid a lot more, and it,
Mhm.
it's worth it.
Yeah. Awesome. Did you have any problems with like work-life balance or anything like that? Has that been okay? A lot of us have families as
Yeah.
well. Kind of wondering about that. So
It, it's hard. Out here, I'm on call every third day because there's only 3 surgeons and one is going to retire, and I'm still going to be on call every third day because being on call more than that is not possible.
yeah.
Back at Mayo, I was on at worst every 4th day, but at best it was like every 6th day.
Oh,
Um, but the call was busier there, So it's less busy here, but it's more frequent. I was on call the last 48 hours before today and didn't have a single consult.
Oh, wow.
I thought I was going to have one last night, but it didn't happen for whatever reason.
Okay.
It's you get better at it. You get better at balancing things.
Mhm.
Um,
Yeah.
but it's hard because you can't be available for a lot of other things.
Mhm.
It's part of the job.
Yeah. I guess I'll hang out with family though while on call, right? So
Yeah,
it's okay, right?
yeah, of course. I
Mhm.
mean, I can still, yeah.
You can
I
still
don't
do
have to go
things.
into the hospital. I'm home
Oh,
on
gotcha.
call.
Okay.
Yeah. I think that the data shows that like being on call every fourth day is about ideal. So you're on 7, maybe 8 days a month.
Okay.
Um, but of course, less would be easier. I wish I had less, but it's not. It's not really part of the job. You don't get the good cases unless you're on call
Yeah.
or something like that.
Yeah.
Yeah.
Any crazy calls at all? Call cases?
um, there's, yeah, I mean, there's the usual like perforated things, and yes,
Yeah.
nothing like outrageous out here because if it's that crazy, it tends to go away just because we don't have a big facility. But there's been a couple of gunshots out here. There's been car accidents and chest tubes, and yeah,
Okay.
it's kind of normal, fun stuff typically.
Awesome.
Yeah, it's a good job.
Good. Awesome. Okay. I think that's pretty much all for what I have.
Yeah,
Okay. So let's bring this episode to a close. I just want to thank you again for being here. I know it's a busy time, so I appreciate taking the time to talk with me.
of course.
The surgery becoming more competitive each year is definitely reassuring, I think, to hear from a Ross alum who's found success, in this field. So to our listeners, thank you guys for tuning in. I hope we found today's conversation helpful. As always, if you guys have any more questions or ideas for future podcasts, please feel free to reach out and let us know. Take care, and we'll see you in the next one.